Hi, my name is Shelby Daly, and I'll be presenting on the NATA position statement on management of athletes with type 1 diabetes. Diabetes mellitus is a condition when the body can't use glucose correctly. It is a chronic endocrine disorder where the person is at risk of macrovascular and microvascular and neuropathic complications. Diabetes mellitus is characterized by hyperglycemia, which can lead to long-term damage or failure of various organs if not managed properly. Management of consistent blood glucose levels, blood pressure, and lipid control will prevent diabetes-related complications and quality of life. There are two types of diabetes, type 1 and type 2. People suffering from type 1 have an absolute insulin deficiency, an autoimmune disorder that is genetically obtained. In the United States, about 20.8 million people are living with diabetes. Studies support physical activity for people living with type 1 diabetes. However, exercise and competition can cause disruption in normal blood glucose management. With a well-organized management plan, diabetic athletes can participate in physical activity and competition and contend equally with their non-diabetic counterparts. Certified athletic trainers need to have specific knowledge and problem-solving skills to help diabetic athletes as required. A diabetic care plan should include guidelines for blood glucose monitoring, insulin therapy, a list of other diabetic assisting medications, hypoglycemia recognition and treatment, instructions for using glucagon, and prevention signs and symptoms, and treatment for hypoglycemia and ketosis. In the plan, the athlete's emergency contact information should be easily accessible, and they should have a medic alert tag with them at all times, along with the guidelines for the diabetic care plan. Supplies needed to be readily available for use. Supplies include blood glucose monitoring equipment and supplies, supplies to treat hyperglycemia and glucagon injection kit, urine or blood ketone testing supplies, sharps or containers for proper disposal, and spare batteries for measuring equipment. For an athlete to be able to participate in sports with diabetes, they need to have tests done for their pre-participation physical exam. To assess their long-term glycemic control, they need to test their glycosylation hemoglobin assay and have an annual examination in their renopathy, nephropathy, neuropathy, and an annual foot examination to check sensory function. When working with diabetic athletes, athletic trainers need to know that the athlete is also living with other health complications that come from living with diabetes. Common complications are retinopathy, nephropathy, neuropathy, and cardiovascular disease. Diabetic nephropathy is an increased urinary protein excretion. Peripheral neuropathy involves the dulling of sensory perception and tactile sensation, most prevalent in the lower extremities. Autonomic neuropathy may affect the cardiovascular, gastrointestinal, and neuroendocrine systems. This may result in unawareness of hyperglycemia or exercise intolerance. Annual examinations should be made to check on these complications. To be able to recognize, treat, and prevent hyperglycemia, one needs to monitor blood glucose, carbohydrate supplements, and insulin adjustments. There are different severities of hyperglycemia, and the athletic trainers should be trained on the different stages and what should be done. To prevent episodes, an athlete with type 1 diabetes should avoid exercising during periods of hyperglycemia. If insulin is needed, it should be administered in the subcutaneous tissue, such as the upper thigh or arm. Depending on the type of insulin, environmental temperature should be noted 1 to 3 hours after administering the insulin. The temperature affects the diffusion rate of the insulin in the body. Trauma can also trigger the hyperglycemic state and can impair the wound healing process. A glucose management protocol should be developed in case of an unexpected injury. When traveling with a diabetic, The Transportation Security Administration (TSA) guidelines for traveling should be reviewed for carrying diabetic supplies. Extra prescriptions should be carried in case it needs to be replaced. Prepackaged meals and snacks should be available so that their food pattern isn't interrupted. With proper management of the blood glucose levels in a diabetic patient during activity should allow the athlete to compete in a safe and effective manner. A team management approach for support for the athlete is the best way to prevent and manage episodes. The management team should include a school nurse, coach, and a school administrator. For adult athletes, their management team should include several health professionals. The team should be trained to assist the emergency. Hyperglycemia is an acute complication that is usually caused by exercise. Males, adolescents, and diabetics that have already experienced a severe episode of hyperglycemia are at higher risk of severe hypoglycemia. Most commonly, an episode will happen because of over-insulinization. This happens because of the rate at which the insulin injection is absorbed into the body. Because of the rise in body temperature and blood flow when exercising, the injection absorption increases, and administered insulin levels from an injection does not decrease when a diabetic is exercising. The inability of decreasing the insulin levels can cause hyperinsulinemia. This initiates hyperglycemia. Symptoms include autonomic or neurologic dysfunction. If glucose levels are not stabilized, severe brain damage or death can result. This creates an importance on making sure that episodes are prevented and managed appropriately. Even though exercise is recommended for diabetics, it can also cause disturbances in management of their condition. There are many triggers that can tip the balance of the athlete's blood glucose levels, but maintaining stable levels is the goal of the athlete and can be achieved through a team management approach. With this plan in place, the diabetic athlete should be able to enjoy and compete as a normal athlete in activities if their disease is well managed, tried to be prevented and treated correctly. Thank you for watching my video.